All right, good afternoon to all of you. Welcome to our 164th news conference regarding the COVID-19 pandemic. Today, I know that many of you have questions about the termination of one of our former firefighters, and I'm going to address that. But I will tell you in the beginning that I'm going to make some comments about it, but I'm not going to, after I make the comments, I'm not going to respond to any other questions. We have well-established processes here in Orange County with how we deal with employees who are subject of disciplinary action. So I'm going to suggest to you that you lean in and listen very carefully, because I'm not going to repeat or respond to additional questions in this regard. So first, let me just say this. When it comes to our firefighters, I want you to know, I want the public to know that we value, we respect, and we love our firefighters. We support the men and women who volunteer to become first responders. We know, I know that as public servants, they have taken an oath to serve and protect their community. We know that the job comes with risk, and on many occasions, these same individuals become our heroes. However, you will likely never hear a true hero regard themselves as a hero. Orange County has demonstrated over time that we acknowledge the risk of our first responders, and we acknowledge that they assume that risk. That is why we compensate them with special risk pay and provide them with all the necessary training, equipment, and supervision to keep them safe while they protect and serve the public. Recently, we signed a labor agreement with the International Association of Firefighters Union to compensate our firefighters better than they've ever been compensated before. Yes, we asked them to get vaccinated during the present pandemic in order to protect themselves and the public. I find nothing inconsistent in this directive with other directives that we have given them to ensure the quality of fire and EMS services we provide before, during, and after the pandemic. Clearly, vaccinated firefighters are better prepared to serve than those who are not. Our legal advisors have opined that our directives are well within the law. Unfortunately, the governor and others have politicized getting vaccinated. They seem to care more about using firefighters as political pawns rather than as public servants who are entrusted to protect and serve. We remain steadfast in our responsibility to mitigate the spread of COVID-19 in our community. I just want to remind you that we reached agreement with the International Association of Firefighters on what the discipline would be for those who fail to get vaccinated. That discipline was a written reprimand. But now the governor has created this political theater like he has done so well throughout this pandemic. The overwhelming majority of our firefighters complied, and only a few did not comply. In fact, 95% of our total county employee complied. 88% of our Orange County Fire Rescue Department complied. Only one individual a battalion chief chose to be insubordinate and was fired by the fire chief. Now, I want to be clear here. I support the action that has been taken in this regard. There is an established process for disciplinary appeals, and we'll address inaccuracies made by the former firefighter. We will aggressively defend our right to protect our citizens and our employees. We'll let the courts decide what was lawful or not. What truly is sad in this case, as we begin this 164th press briefing today, I say sad and ridiculous, that over 58,000 Floridians have died as a result of the COVID-19 and the failed leadership in Tallahassee. So you ask me, what is my response to the governor or anyone else? I say these simple words: bring it on. So with that, I'm going to move forward with the rest of our press briefing, because now I've addressed that. Okay, so don't ask me any other questions relative to that today. In the next few weeks, the FDA and the CDC are expected to approve Pfizer's vaccine for use in children ages 5 to 12 or 5 to 11. Dr. Pino may talk about that with more details in just a few moments. One thing that we've learned is that the doses as well as the needles will be smaller to better suit young children. We look forward to this final phase of getting the youngest members of our population inoculated against COVID-19. As we await word of when the vaccine will be available for children, the percentage of Orange County residents aged 12 and older with one or more doses has now reached 75%. That's a good number for our community. And it will be great to see this percentage go even higher when children start getting vaccinated. Yesterday, the FDA authorized Moderna and Johnson & Johnson as booster shots, allowing the mixing and matching of different kinds of COVID vaccines. I'm not a physician. Perhaps Dr. Pino can talk about that as well. We do want our residents to know that Orange County Health Services staff is prepared to provide booster shots to our community once the CDC finalizes the guidelines. We do have Dr. Yolanda Martinez from our Health Services Department who's here should any questions come up about the process that we will use. Currently, eligible residents may receive Pfizer's first and second doses and the booster shots, Moderna's first and second doses, and the Johnson & Johnson first dose. Just as a reminder, Barnett Park is open for vaccines between the hours of 9 a.m. and 5 p.m. every day, 7 days a week. If you want more information about the vaccines, go to ocfl.net/vaccines. And let me give you an update where we are with the coronavirus here within our community. There are now 231,363 coronavirus cases reported in Orange County. The number of Orange County residents who have died from COVID-19 has now reached 2,147 deaths, which is up 21 fatalities since we met last week. Sadly, we had another member of our Orange County family, one of our corrections officers, who passed, died of the coronavirus. Our hearts continue to go out to all the family members who have lost loved ones and our staff. There continues to be a positive trend with the 14-day rolling positivity rate. Today, it is reported as 4.09%, and the 10th consecutive day that it has been at or below 5%. What this means to our community, we're monitoring this closely. I do anticipate that next week we will likely make a decision where we will no longer be under a state of emergency in Orange County. So stay tuned. The CDC still has our county rated as orange, which means that the community transmissions is considered substantial. So what are we doing about it? We have continued to make certain that our vaccine trailer remains mobile. We're working in partnership with our local Department of Health, and we have a busy weekend planned for our I Got My Shot trailer. Tomorrow, Friday, the trailer will be at the Inglewood Neighborhood Center between the hours of 11 a.m. and 1 p.m. Saturday morning, it will be at the Camden North Quarter on Orange Avenue between the hours of 9:30 a.m. and 11:30 a.m. Then it moves in the afternoon to Lake Heininger Estates near Apopka between the hours of 1:30 and 3:30 p.m. And on Sunday, it will be at the Bears Who Care Run in Winter Garden, starting at 7 a.m. through 10 a.m. All of this information may be found at ocfl.net/IGotMyShot. There are still 2 county-run sites that offer free COVID-19 tests each day. The Barnett Park testing site is open between the hours of 9 a.m. and 5 p.m., and the Econ Soccer Complex site is open between 9 a.m. and 4 p.m., again for COVID testing only. You can go to ocfl.net/testing if you need more information. We continue to reach out to our residents who are in need of emergency rental assistance. To date, 2,132 families have qualified for help with their rent and have avoided eviction. More than $11.8 million have been approved for distribution to those families. For more information on our rental assistance program, you can go to ocfl.net/rental assistance. We are continuing to move throughout our community with our advisory committee for redistricting. The meeting will be in District 1 this coming Monday at the West Orange Recreation Center beginning at 6:30 p.m. For more information about redistricting, you can go to ocfl.net/redistricting. And now I'm going to ask, before we go to Dr. Pino, Chief Lauralee Avery from Orange County Fire Rescue. Chief, she has a special presentation today. Why don't you come forward, Chief? She's got the whole team from our Emergency Operations Center with her.
Good afternoon. As we all know, the last 20 months have been quite incredible as we continue to make progress with the pandemic. Just want you to know we're still very heavily involved in a lot of different areas, trying to make sure we totally recover. I do have some of my team from emergency management behind me, and I know they want to share in this. Thank you from also the mayor and the whole county. Throughout this pandemic, as the mayor has said, I've too lost a couple of loved ones. So the COVID pandemic has impacted me in a very personal way. So with that being said, we have built so many strong partnerships throughout this pandemic. So although there's a lot of negative, unfortunately fatalities and some other bad things that have come from the pandemic, there's also been some amazing partnerships that have been built. And one of those partnerships, I just don't think that we've ever historically had such a strong partnership with this team. So Dr. Pino, if you'd please come here. So we want to give this to you, and although it has Dr. Pino's name on it, there are thousands of people behind you that helped the team effort. Let me put my glasses on. So this says, with our greatest appreciation, we hereby present Dr. Raul Pino with this award in recognition of your unwavering commitment and dedicated service to the, yes, come on, you guys come up too, and dedicated service to the Orange County community in the face of a global pandemic. So we just want to take a moment, and they're still working very, very hard, as we all are, but without their partnership and their medical expertise, it didn't matter if it was a night or a weekend. I could always pick up the phone. I know the mayor could as well, any of our staff. The strong leadership that DOH, the Department of Health, provided to all of us throughout this pandemic and is continuing to provide us is just incredible. So I know I'm saying this from all of us, we're just very thankful. So thank you, Dr. Pino.
Thank you. Thank you. So, I was wondering why my staff was here. I didn't know, and I was thinking that I should have introduced them then at the beginning. And thank you, guys. I mean, the partnership is with you is amazing. And our residents don't know how much work requires to even coordinate between two institutions. So thank you for that. You are the partners, not us. And so you guys know, there is Michelle Persoa, and for me, at the health department, she is the head of an epidemiological department right now. But for me, she is my lab person, meaning any question, any small details about the many lab tests that are going around, our relationship with all of the companies, including the state lab, everything that has to do with lab, that's done by her, not by me. What you see when I say it here is the product of her work. And the same for Cassandra. Cassandra Fonseca is the one that generates all the data, all the analyticals, my internal seat report that we see every day, and the data that we are able to provide to you is ready at 10 o'clock in the morning. And I don't know what time Cassandra gets to work, but it's ready at 10 o'clock in the morning and ready for a lot of us. And you all know Albina, who is the head of our infectious disease division. And you all know Albina and what she has done for all of us. And then Ken, who keep us in contact with the press, which is also an immense and so important partnership that we have with you guys. So thank you. Oh, quick photo.
Interrupt the press conference for a photo.
Okay.
You're in the front, you got the order. Oh. You got the order. Yes, sir. Good. Over here?
Okay.
Don't block anybody? You're blocking. There. One more. Thank you.
It's your word too.
Thank you, Dr. Pino. On behalf of the 1.4 million people who call Orange County home, we do appreciate the partnership with the Florida Department of Health at Orange County. They have done yeoman's work with us for these many months now, and so we will never forget the partnership that we have with you. Thank you.
Thank you, Mayor. I'm one of the 1.4 residents, and we count on your leadership to keep us safe. Thank you, guys. The numbers for today, as the mayor mentioned to you, we have 231,363 cases, and we are holding our average positive rate of 4.09. That is just absolutely excellent. Unfortunately, our number of deaths have risen to 2,147, and one of those, believe it or not, is from February, that was reassigned to us. 15 are from September, and 6 are from October. So with that, you can see changing in the numbers 1 or 2 when they get reassigned here back and forth. Of the total death that we received, that we informing you today, 3 of those, 13.6% were in assisted living facility, and 6, 27.3% were fully vaccinated. There were none partially vaccinated in that group. As the mayor also mentioned to you, we remain in orange, although we are expecting that this could change quickly. And remember that vaccines are available for everyone. And for those parents who want to book the vaccine for the children, when it becomes available for 5 to 11, remember that your pediatrician can provide, order, and administer the COVID vaccine to your child. They have access to the systems, they can order. So if you prefer a private environment for the safety of your child and your family, that's a good place to go for a vaccine. We are not anticipating mass vaccination sites like we saw before from the state, but we may work with the county, giving additional resources if we have it, to provide those locally. Also, we are interested in providing vaccines at the school and working on protocols and procedures with OCPS to do so, as well as with a contractor. With regard to the number of deaths, as there has been some movement, I would like to let you know that August continued to be the deadliest month in this pandemic for us. So far, August 2021, we are at 410. September is now at 278, and October continued to be low at 10 for where we are in the month. So clearly there has been a decrease in the number of deaths. It's not easy to reflect by the numbers that we are given, as there are some accumulation of data from prior months. But also on the vaccine side, we continue to do very well. 66% of our population is fully vaccinated, mean complete, and that's 66% of our population, and 75% of all our residents has at least one dose. For people 12 to 17, something that we are continuing to follow closely, we are at 67% of our least one dose. Now, with these immunization rates, and the fact that a large segment of the population, mostly unvaccinated, went through the latest Delta variant, we think that we are in a better position to confront the holidays. But that doesn't mean that we should not be careful and be alert and practice preventive measures as suggested by the CDC when we are in gathering places, indoors, on what we are going to places where we don't know who is there or who has been vaccinated or not at home. And for the holidays, we continue to provide the same information. Please wear your mask if you are among people that you don't know the vaccination status, especially if you are indoors with large gatherings. And please, if possible, have your celebrations outdoor for Halloween, for Christmas, and for Thanksgiving, so that we'll limit the possibility of new infections. But again, with the rates that we have, we should not experience what we experienced last year. With that, Mayor.
All right, thank you, Dr. Pino. At this point, we're opening up for questions. I do want to make sure that you're aware, as we do on many occasions, we do have Commissioner Gomez-Cordero, who has joined us. Ms. Elio Torres is here to do translations for Spanish if needed. We do have in the audience our HR director, Mr. Ricardo Day. If you have any specific questions of an HR nature, we will call him up. We do have Mr. Scott Howard from the Orange County Public Schools who's here. And I believe those are the staff persons that we have here. And yes, we do have Dr. Christian Zuber, our medical director for Orange County, if there are any questions related to decisions that we have made at this point. He is part of the team that I rely on for making decisions. So with that, we'll open it up for any questions that you may have at this time. And remember what I said to you from the very beginning.
In that note, point of clarification for you, Mayor Demings, and a question for you, if you don't mind, Dr. Pino. Point of clarification just being, when you say bring it on to Governor DeSantis, does that mean Orange County was prepared to take this to court if necessary, his latest announcement? And for you, Dr. Pino, do you know how many child vaccine doses will be coming to Orange County in the first round of shipments?
No, I don't know the amount, but there is sufficient vaccine out there. The vaccine is the same. What is going to be different is the amount that is given. In many cases, medications is done by weight. That's why children will receive a lower amount, but it's probably based on determination during the clinical trial, what was the lowest amount sufficient to develop sufficient immunity, and that's probably what is going to happen. But we don't know the number of doses, but we don't anticipate at the levels that we have right now that we will have any shortage.
All right.
Steve Hudak from the Orlando Sentinel. Mr. Mayor, I don't know if you can speak to this. First of all, have you received any word from Tallahassee about fines?
No.
Okay. Secondly, I know that's an easy one. The second one is, has the county been able to determine how many employees were vaccinated prior to the mandate being issued?
We don't have the specific numbers. What we do have at this point are the numbers of employees who, after the mandate, after the deadline, were vaccinated by department, et cetera. And if you want to engage our HR director at some point afterwards, he can get into any specific details there. All right.
Mayor Demings, Asher Wyman, Channel 13. A couple things. First off, what are your thoughts on Governor DeSantis ending the vaccine mandates and just trying to do everything combative, it seems, to what you've been trying to accomplish in Orange County? And then the second part is, I know you said 88% for firefighters about 3 weeks ago. They were only at 46%. I'm told they've had about 100 religious exemptions. Is that equating into your numbers? And can you really quantify how many firefighters have in fact been vaccinated?
Yeah, we can quantify that. And again, the HR director can provide that information to you. And I'll leave it at that.
I don't have a question, but I guess I can ask one about the schools. Do we know anything? We've been getting some messages, parents concerned that their kids are having to wait a long time to get on the buses, and oftentimes the parents have to get out of work and to go pick them up. What is the situation with the school buses in Orange County?
Sure. So thank you. We've, since the beginning of the year, had some challenges hiring bus operators. We're in the process of filling about 100 positions. We have about 30 to 40 routes that aren't filled currently. Many of our drivers are driving or doubling up on routes. So it's been an ongoing issue. We've worked really hard to try to make the process of onboarding tighter so we can get our bus operators in place more quickly. This is a national problem. It's a statewide problem, and it really needs to be addressed in Tallahassee. We need to pay our drivers and provide better wages for our bus operators. The flexible dollars that we get from Tallahassee to go towards transportation just aren't there. Right now, our transportation funds are funded at 45 cents on the dollar. Every penny that's not funded is coming from somewhere else, primarily out of the classroom. So we need more money coming from Tallahassee to help us increase what our drivers are getting paid, what our mechanics are getting paid, so we can increase the number of drivers out there and reduce the number of late buses that are being delayed because of that. And that's not just in Orange County. That's statewide and that's national. So thank you for your question. Thank you, Mayor.
Lauren Cervantes, WKMG News 6. And Mayor Demings, thank you. I have a question regarding Governor DeSantis' words this morning. He called it an unlawful termination, saying it's not legal to mandate the vaccine and that this isn't over. He's now calling for a special session. What's your response to that?
Let me just say this. I said earlier that, my attorneys here within Orange County, great attorneys, have opined that we are well within the law. And as we move forward, whatever the governor does, whatever the legislature does, they do. I don't know. The fact that they're trying to do a special session indicates to me there's something wrong with the current law, and it does not result in the things that they want to accomplish. So we'll see.
Kelsey Thord with West 2 News. That was also kind of my question. But just going off of that, how confident are you? I know you said that you've talked to legal advisors here in Orange County about the mandate. How confident are you that you guys are going to win this?
I gave a statement earlier. You should have derived from that I felt pretty confident about what I was saying. And just as I have, even prior to today, I felt confident about the actions that we have taken and whether or not they were lawful or not. I don't want to repeat myself over and over again, just because someone else challenges that confidence that we have. We'll see.
This is Melissa Thomas of Florida National News. This question is for Dr. Pino, so we'll give you a break, Mr. Mayor. Dr. Pino, I did want to ask you about, I know recently, during last press conference, you mentioned the importance of getting the flu shot, and there's also the importance of getting the booster shot. What is your message to folks that are hesitant with especially now that the government is authorizing, or the CDC is authorizing the mixing of the different vaccines, kind of assuage some of our folks' hesitancy with regards to so many vaccines?
Yeah, and listen, we understand why people are confused. Sometimes we are confused ourselves, and sometimes we have to check what we said yesterday and what was said today, because it changed all the time. So the mix and matching, we have said before here that, at the beginning it was people were concerned about getting a different second dose from a different vaccine. Will that kill me? Of course, it didn't. And of course, we said that it was not recommended at the time because it wasn't sufficient data. But if that had happened, was no reason to be alarmed and to go ahead. People didn't need to initiate the series again. Now, the mix and matching is also in part because, the Johnson & Johnson vaccine has demonstrated, and from the beginning, had a lower effectiveness than the other two vaccines, and it was only one dose. And now the booster for Johnson & Johnson is recommended for after 3 months. I haven't digested everything. Is it 3 or 4? 3. Johnson & Johnson, 3? After 3 months, Johnson & Johnson is recommended. The other ones are recommended the booster after 8 months. That's an indication. I haven't seen the data, but that's an indication that is waning the immunity quicker than the other vaccines. That's why it's suggesting to do it at earlier stages. So that's clarification there. and the vaccines can be mixed. And actually, it has been debated in the scientific community that it could be a good thing to mix the vaccines. Because Johnson & Johnson and AstraZeneca develop immunity through different pathways than Moderna and Pfizer. And although you develop immunity and it will protect you, by crossing the method through which the immunity is acquired may increase those levels. So that's part of the reasoning behind mix and matching. I didn't mix because I didn't need it to, but many people have done it, and it's absolutely fine. With regard to the flu, what we said before is that this isn't a normal year for the flu because it was so little flu last year due to all the measures that we took and people being indoors, and the state was closed for a few weeks. So all that impacted transmission for the flu. And we are coming to the conclusion that community immunity levels for the flu are probably at the lowest they've ever been, because first, it wasn't much infection last year, and because it wasn't much infection, not that many people got vaccinated either, because, we were dealing with this pandemic. So our concern is that even people that normally do not get the flu vaccine should consider the flu vaccine this year. Everyone who is now allergic to any of the components of the vaccine should consider getting vaccinated for the flu this year, because the concern is that we could see a spike in flu cases compared to prior years due to the fact that we may not have the same level of immunity that we had before. I know that was a long talk but you have to explain the whole thing so people can understand. Sorry.
Danielle Lama with Fox 35. This is for Dr. Pino and Scott as well. I'm assuming when you're talking about vaccines in schools, that's when 5 to 11 years old is approved. Can you just give us an idea of what that could look like?
Well, we have done vaccines in the schools already. The OCPS and Florida, Health Leader Florida and us, we have worked together and provided some vaccines in the schools. So that can look different ways. There is the possibility we continue to work. We are working with OCPS and the state to acquire additional resources so that we can place additional nursing staff or clinical staff. It doesn't have to be a nurse, but LPNs or nurses aid in the school system so that they can provide us with help to continue testing through the schools. Even though the pandemic is at a very low level, it will be also critically important for us to know what kind of asymptomatic transmission is happening in the schools. And what we are going to be after is what level is sustainable and at what level you start seeing cases and disruption. And because what is going to happen with this pandemic at some point is that you will start seeing smaller and smaller and smaller outbreaks. That's the way that it should shrink. We should start seeing a smaller and smaller outbreak. And the scientific community suspect that maybe for a couple of years, we could have a low base of cases going on that we will be able to provide. That's one way. Another way that it could take shape, and we haven't decided on this one, and I'm going to say why, is that we could open a vaccination site, very short, maybe 4 days, because we have about 126 people in that age group, 5 to 11. If we suspect that about 50% of the people will get vaccinated, the first wave, that's about 80. If we take 20,000 that we can do in 3-4 days, that would be a big help for the community. Because the idea is to vaccinate as many people as possible, as fast as possible, so that we can sustain this level of transmission even with the holidays coming. We haven't done that because vaccinating children in a mass vaccination event add additional risk. They move a lot, some scream, the youngest are afraid, some people may start running away from a vehicle. So there are other considerations that we have to have in consideration.
what Dr. Pino said is fine. I'm good. Yeah, we are working on plans for rolling out vaccines in schools. Of course, parents have to be present, so we'll make sure that it'll happen after school and they'll be able to pick up their child at their elementary school. We'll do geographic locations throughout the county, make sure they're publicized well in advance. We'll allow them to come in and be able to do that through Health Hero, through our third party. So we have a schedule right now that we're working on and working with Dr. Pino's staff and that will roll out. Right now, we want to work on the education piece, make sure that we're working with our school boards, medical advisory committee to get information out. We'll be working on doing that prior to the vaccine rollout as well. So that'll be a big part of it. But get them comfortable so that we get as many vaccinated as possible, as quickly as possible. So thank you.
I have two questions that were texted in. They're for you, Dr. Pino. The first one comes from Valerie Bowie with Fox 35. Her question reads, Dr. Pino, is it usual for a fully vaccinated person to get COVID? Has this been happening more often? And I believe she is referencing a healthy person with no underlying conditions.
So I don't know, it has been happening more often. I don't know if we are on the national level following the data. It happens. People should go back to the beginning of the vaccines coming out. And if people remember, it was always said that the vaccines will protect you against illnesses, severe illnesses, and hospitalization and death. At the beginning, we didn't know how much it would protect against infection, acquired infection itself. And it could be that the numbers are higher than we know, so that's why the data should not be trusted that much in this sense, because many of those reinfection or breakthrough cases may have gone asymptomatic, because when you have a vaccine, you are less likely to develop, that kind of sickness. So with that is to say that there is not a 100% effective vaccine out there, and these vaccines are among the most effective. And I continue to say, we analyze the data periodically. Its effect for us here in Orange has prevented hospitalizations and death by about 98%. So that's significant.
And lastly, from Ryan Lynch in the Orlando Business Journal, Dr. Pino, do you expect the increase of international travel in November to increase local positivity rates? If so, how?
Probably not. It will not increase a positivity rate, although I think the person is referring, are we concerned about international travels coming and increasing the level of infections in our community? It will not increase positivity rate. I'm going to tell you why, or maybe very little, because people leave very fast. People come to Orlando for 5 days. The tests have to be done here for us to get the result as a positive result from Orange County. You have to be a resident. For travelers, I don't know how that works, to be honest with you, but most of them are not diagnosed in here. So that will not increase our positivity rate. Now, if we are talking about infection, that's always a possibility. And that's why we have said always that Orlando and Orange County is a very special place, because whatever happens in the world will happen here. And that's why we need that extra protection.
Thank you. Thank you.
All right. The next news conference is scheduled for next Wednesday, October the 27th at 11 a.m. Thank you all for joining us today. We hope you have a safe weekend coming up.